Good morning, everyone. It is a great privilege to be invited to give this presentation. I'm sure you've been enjoying the morning session, and we're all going to enjoy the afternoon session as well. I hope that you will find my presentation useful. It's going to be a very personal presentation. I'm going to tap into my own personal knowledge and experience of being a spiritist person and also a mental health worker, and how to bring those two together. So you might ask, how does my spiritist knowledge and faith inform my practice? I believe that life does not start with the physical body and it doesn't end with the physical body. I believe that we are given many opportunities of learning, the same way that we go to school and we don't have to learn everything in one day or in 1 year. We are given the opportunity to go back and try again if necessary. So we do in our lives. And first of all, I think the main thing that Spiritism gives me is I'm not afraid of being who I am. Spiritism gives us that strength, that moral strength to be who we are. And I never hid my faith from anyone, including my employers and even my patients. But the big important caveat is that Spiritism also encourages us to be respectful of others, and especially of other people's faith. So that is a priority for me. So being a spiritist makes me the person I am, to behave the way I do, to think the way I do. And a big part of it is to respect my clients, my patients, for who they are, good and bad, and not to try and impose my faith, my beliefs upon them. It's all about free will, but also understanding that we can better exercise our free will and our choices if we have enough information about what we are choosing and what the consequences are. And that is a big part of Spiritism as well, the freedom to choose, but the necessity to inform ourselves. In that respect, I would just explain briefly what for Spiritism is the human complex. There is a lot more information that you can find elsewhere, and this is going to be mentioned in other presentations as well, so I'll just mention it briefly. So the Spiritism sees humans as a trilogy in a way: body, perispirit and spirit. The body being the physical part of us, the neurosystem, bones, skin, hair. And the perispirit is the fluidic envelope that acts as the intermediary between the spirit and the body. It's also where the memory and records of previous lives is located, so that sometimes that resurfaces. The spirit is the thinking part of us, where the mind is located and the real us. Now the perispirit is the blueprint for the formation of the biological body. So if during our previous existences we have created problems, disturbances that have become imprinted in the perispirit, it will reflect in the physical body. It's composed of particles identical to those that compose the physical body, but vibrating at a different level, at higher frequencies. So we can use the analogy of water. Water has three main different states. The lower vibrations is the solid, the highest is the gaseous, and the intermediary is the water. So the perispirit may be composed of material particles, but it vibrates at a higher frequency, making it a good connector between the spirit and the physical body. And of course its composition is strongly influenced by the mind here being the thoughts created by our spirit. So now we need to distinguish the mind from the brain. The brain is the physical part, the hardware in a way, and the mind is the software, where the software is generated. So the mind, the spirit being the programmer that programs the software that then is run through the brain. So if there is a problem with the hardware, via brain damage or genetic conditions, then our expression and understanding and reactions to the world around us is going to be dysfunctional. If there is a problem with the way we think and feel with the software, then our reactions is going to be disturbed as well. So if we fail to understand our patients as a complex but individual entity, then we fail them. If we only see our patients for the physical aspects, we are going to be missing quite a big part of who they are. If every mental disturbance is interpreted by us as a spiritual disturbance, as an obsession, then we also miss the point, because the problem is the close interaction between the spirit, the perispirit, and the body goes both ways. So long-term mental emotional disturbances can cause more permanent disturbances and blockages in the physical body as well, making it impossible to reverse a diseased process. So let's have a look at the thought. Thought originates in the spirit and not in the brain. So thought is part of the software, not the hardware. The hardware is the machine that we use to express our thoughts. And thought is consistent of material particles as well. They are much more subtle than even the perispirits, the one that composes the perispirit, but yet matter. We know that thought affects the composition of the physical body. It affects the way we respond to medication. The placebo effect is well known. When someone is taking something believing that it has the active component, even if it doesn't, if I feel that that's going to, if I believe that it's going to help me in a large number of people, it causes physical change to the biology of the body. And sometimes it works even better than the real medication, but taken by someone who doesn't believe that it will work for them or doesn't want to be cured. And when perturbed, the mind creates very potent and detrimental, destructive energies that will affect our physical composition as well as our behavior. So negative thoughts have a very practical and physical impact in our brains that could lead not just to hormonal disturbances, causing things such as depression, for example, hallucinations, but it can even cause permanent damage that impacts on our behavior and our quality of life. According to Spiritism, all morbid processes are essentially mental processes. So how we think, how we feel will affect our physical constitution. And health is the soul in a state of perfect harmony. So we see people who are happy and carry terrible disabilities or terrible illnesses, because happiness and well-being, resilience, it doesn't belong to the physical body, it belongs to the mind, to the spirit. In that respect, I understand that someone who comes to me with a genetic disorder, their brains, their mind has been wired in a way that causes them to respond very between two extremes, like borderline personality disorder or bipolar disorder fits into that category. I know that from a physical perspective, this person will always face challenges that other people, the normal, average person, don't have to face. So my role as a mental health worker and as a spiritist, guided by my spiritist beliefs, is to help these people to come to terms with those challenges rather than fight them, and have hope in the future. If I can impact hope and faith in someone who came to me with none, that in itself is going to start creating some energies of health that can counterbalance, not completely perhaps, but help in their own biology, biochemistry, and help them to respond better to medication, to manage their mood a bit better. So looking into the future. As a spiritist, I'm never looking only on today and tomorrow or even next week. I'm always looking at the spiritual future of my patients. So if something can't be fixed in this life, my role then becomes to help them to accept it and look further than this life. Not using this vocabulary a lot of the times, but just helping them to feel that there is hope in their future, that their future is not doomed to be as hard as their present is. I think mentioning the aura is important here because we attract what we are, because we radiate energies around us. Every time we think or feel something or behave in a certain way, we create this energetic field around us, which can be healthy or unhealthy, and we interact with each other's energetic fields. Like our scents can be mingled in a room. Our spiritual scent can be mingled as well. So for example, someone comes in with a history of heavy drinking, being a horrible person to their friends, even a life of crime, and something makes me warm towards them, feel kind towards them, and I don't know why, because their behavior is the opposite to what I believe should be. And then someone else comes in, well dressed, well spoken, well educated, and I just don't connect with that person. This is because we are communicating at the energetic level, and there is some affinity there that connects us in a positive or not so positive way. Now, being aware of it, my responsibility as a practitioner, as a health worker, is to pull my energies back and either become overindulgent to the lovable rogue or overly critical of the well-spoken person that I have difficulty with. And also to remember that they may be feeling similarly. They might be feeling some dissonance towards me. So I need to work even harder to be as kind and to irradiate as good as energy as possible, enveloping them in love, understand, kindness. And it is incredible how powerful those energies can be, those thought processes can be, because it really can make the difference between someone staying the course of treatment or walking out and never coming back again. So we attract what we are, and once those connections are made, it's not always possible to undo them. So someone who is a heavy drinker, for example, or a drug user, it's natural that they will look to spend more time with people who engage in the same things that they do, because they will support each other, they will be kind to each other, they will be forgiving of each other. So when that happens, it's the same as someone that struck a friendship with someone who's not good for them. I was having this conversation with some people I know recently, because they were saying, oh, that person is not a good company for my son or my daughter. I said, well, it goes both ways. If they are caught doing wrong together, why is it always us that thinks that someone else's children are not good for my children? Because they are together, they are interacting, they are doing the same things. So maybe there's a possibility that my children might not be good for that person's child. When this is the matter of personal responsibility, which Spiritism is very strong about. It's about empowerment. It empowers us to take personal responsibility for our choices without judgment. So I was having this conversation with one of my clients just this morning, the other morning, when I said to him, be careful not to judge yourself too harshly. Because when we're trying to make changes, very significant changes, we stumble from time to time, and we can become our worst enemy. And if we do, then we attract the people who reinforce that belief about ourselves, that reinforce that belief that we are good for nothing, that we don't deserve to be happy. So And that can be physical incarnate friends or spiritual friends. And that's where things start getting complicated, because as you can see, the symptoms of mediumship are sleep disturbances, anxiety, phobias, hearing voices or seeing things that no one else can see or hear, substance misuse, sudden or gradual deterioration in behavior. So basically fits every, ticks every box of mental health disorders. So how can we tell the difference between mental health problems and spiritual problems? Often we can't. And if we can't, what do? We treat the patient or client as a complex but individual entity and prioritize their immediate needs. Our role as a therapist is not to judge or to diagnose someone, is to help them. Sometimes a diagnosis can be helpful, but even saying to someone you have a diagnosis of borderline personality disorder or a spiritual obsession doesn't help them to solve the problem. What they want is, this is what you experience, that's how you can manage it to stay safer, to be kinder to other people and to yourself, to improve your quality of life. That's our priority, whether it is a spiritual obsession or a genetic condition. Our role is to try and identify ways for the person to manage their present so that their future can be better. So before jumping into conclusions into is this or that, trying to diagnose the problem, we need to consider other aspects as well. Is there a family history of mental health problems, for example? It could be that there is a genetic factor there. What are their belief systems? Do they believe in something else apart from this life? Because if they do, then we can have a more spiritual conversation with them and bring hope into their lives that other practitioners may not be so comfortable to bring or to have those conversations. Other physical health problems that might also interfere. If it's a well-established depression, then medication may be useful. Same for anxiety and ADHD and other health, mental health, physical health conditions, and personality trends. Because basically, we print in our bodies who we are, our personalities that have been developing through many incarnations. And those habits, they are not going to be fixed overnight. But knowing what my personality, the core personality trend is causing the problem may help to tweak it, to start rewriting that program. So I'll give you some examples of the same conversation being had with people of different backgrounds, and the names have been changed, but this history is, these are real patients. So Sarah was a woman of Christian faith with a diagnosis of borderline personality disorder and an eating disorder and binge drinking. And because she had faith, beliefs came into the conversation quite early on, because she said that one of her coping strategies was to go to church on a Sunday. So we talked about spirituality, we talked about the goodness of God, and she asked me to pray for her, and I was very comfortable. And even when we still have contact, I mentioned to her that I still think of her and I still pray for her, which gives her comfort. Now, Carol was a Muslim man who got arrested for drunk and disorderly. So here I knew that this person came from a culture for whom the religious beliefs was very important, and he could be feeling that he let them down by drinking, because for them drinking is taboo. So my priority then was not to talk about God or how bad he was. It was more about asking him, are you a practicing Muslim? Because if he says yes, then I know that God's view of him would be more important, and I could use language that could help him to forgive himself, reminding him that God is forgiving, even if our families take longer to forgive us, and he needed to forgive himself as well. Now John, as an atheist with PTSD, post-traumatic stress disorder, I had to use a different vocabulary, but I still brought spirituality into our conversation. But I used the word mindfulness, I used the word positive universal energies, visualization to describe types of prayer to self-healing techniques to help him to visualize himself protected within a bubble of positive energies. So as you can see, we can tweak the language to help our clients, but we need to respect the core beliefs. So it can be useful to identify how far the problem has gone, because sometimes it might have developed into physical symptoms that needs to be taken into consideration. And if someone has depression, for example, then antidepressants may be very useful. And I don't think we need to be, as a spiritist, we are very open. Spiritism is very open to development, scientific development, and actually instructs us that if science changes, we change with it. We don't restrict the change, we don't resist the change to imprint the old beliefs. No, Spiritism is an evolving faith that goes with time. So we always encourage people to seek other medical advice as well and comply with the treatments that are offered, always trying to modify and improve their mental attitude, which is going to be essential during treatment and long term as well. So mediumship is caused, mental health problems caused by mediumship are due to disturbed thought patterns that are then hijacked by others. And I like to change the word obsession by abuse, because an obsessing spirit is nothing but an abusive entity that sometimes connects with us in a friendly way but causes a lot of harm in the long term. Anything that lowers our mental, emotional energies can become a trigger to both mental health disorders as well as spiritual disturbances. So we need to bear in mind the core problem is low self-esteem, is trauma, is it an overinflated ego, and work with that in mind as well. So the initial stages, as most abusive relationships, it can look very protective and loving, and then it gradually develops in something more abusive. And mental health practitioners are very familiar with this kind of process, a friend that then moves in, that becomes a carer, that then are receiving benefits in the name of the person that they are supposed to be caring, using their money to buy their own drinks, bringing other friends over, feeding them other substances to maintain that control. And again, it doesn't matter, as far as I'm concerned, it doesn't matter if that abuse is being perpetrated by a physical person or a spiritual entity. The core aspect of the problem is the same. We need to strengthen the mind, the resilience of the individual. Of course, if it is an incarnate person, then that person can go to prison if they are committing a crime, and we will deal with it in the way that the law deals with it. We are going to make the report the same way, but we need to bear in mind that if we take a support system out of the picture, we need to be offering something else in place. And that goes for faith as well. If we take someone's faith away, let's make sure that we are replacing it with something better. So if someone is taking advantage of a patient, it doesn't matter whether it is an incarnate or a discarnate entity. We look at the priorities: the safety, harm reduction, support network, so to replace something that's negative with something more positive. And our conversations will represent that as well. The problem is sometimes, because if we don't look at the core factor that is causing that relationship, we miss the point, and we see abuse victims. That happens a lot when they end one relationship and then fall prey to another abusive relationship, because we need to work with the individual. And if it is a thought process that is defective because of past experiences that the person has, maybe even in a previous life, where they have done stuff to other people and they come with that guilt, then we need to identify that if possible, rather than blame someone else for what's happening, but not blaming the individual either. It's about helping that individual to realize and understand that they can change their future. They can't change their past, but their choices in the present can change the future, and become more self-aware. And I use mindfulness a lot for that, because mindfulness is a form of prayer and it's a form of self-healing, and uses neutral language that doesn't carry the negative charge of the religious language. So I can say prayer to someone of faith, but I can say meditation to someone that I don't know if they have a belief, or religious belief or not, or if they have a faith. And that is the same. What the purpose here is to help that individual. And Spiritism gives me this flexibility, gives me this freedom that I did not feel I had with the religions I grew up with. So sometimes we find ourselves in a religious setting that restrains us in terms of what we can offer people. And Spiritism gives me complete freedom, because it gives the focus, puts the focus on the good I'm trying to do to help other people, rather than trying to sell my religious beliefs. So I find it very easy to change the language I use if I need to, without feeling guilty about it, because it's about the good that we need to do, rather than persuading people of our beliefs. So how do we break the cycle when we identify that vicious cycle of self-punishment, going from one abusive relationship to another, one obsession to another? We need to understand that we construct our own social reality. That is, we have free will, we have the freedom to choose, and it's our choices that will make the difference. Social influences shape our behavior, which means if I make choices that bring people who like drinking, abusing sex, misbehaving, committing crimes into my life, it's because if I enjoy those things as well, I might feel guilty, but I'm still enjoying it, because if I wasn't, I probably wouldn't be doing it. So if I start changing the choices I make, then I change gradually, inevitably, the people I hang out with, the people around me. And that's because our personal attitudes and predisposition also shape our behavior. So again, you can see that the science of psychology and Spiritism, they're just using different words to say the same thing. It's about personal responsibility, it's about choice, it's about time. What Spiritism gives me that it doesn't, other religions or science alone doesn't, is the gift of time. The gift to know that life doesn't start here and doesn't end here. Life continues. So the lessons I haven't been able to learn now, I can learn later on if I continue to make the effort. And that goes for my patients. So I never despair, I never lose hope. And the hope I have can be imparted on them as well. We have to be careful, because with our thoughts, and this is one thing that I always stress for my clients as well, make a plan, believe in something, visualize that future you want to have, visualize yourself succeeding, because we can create our own reality, we can create our future, and it starts with our present thought. So our situation will change according to how we change our perceptions of things as well. And I was having a conversation with another patient recently, and she started by saying, oh, it's going to be something negative, and I want to talk about it now because I want to talk about something positive later on. And then the way we talked about it, what did you learn from it? What was the positive about it? So problem-free talking about what can you get from this that will make your tomorrow better? And we ended up agreeing that instead of being a negative conversation, it was actually a very good, positive conversation that made her feel better. The problem still exists. She still has some hard choices to make, but now she's felt positive towards those choices. She felt empowered. So as the process sometimes continue, as I mentioned before, if we don't change the pattern, then it becomes more long-term, and it can impact on the physical body as well, to the point where certain changes can become permanent, but not forever. Permanent in this life, but not forever. So our thoughts determine our behavior determines the type of person we want to be, and our thoughts can act upon other people's thoughts as well. So if I often tell people, go show your positive changes to your friends, inspire them as well. And we've got some good examples of that. Because by sharing our beliefs with other people, by even having that problem-free talk to somebody else, it becomes a catalyst to change in itself. And going back to the examples that I gave earlier, that conversation with Mary didn't change who she was. She's still fighting bulimia and her extreme mood swings, but she now knows that her belief system, praying, helps her. Carl also left the session feeling more motivated, and I haven't heard from him anymore. And John fed back to me that the meditation was helping him to cope with the PTSD, because he was learning gradually to create a safe place for himself, where when he had the flashbacks he could go into the safe room and ground himself and feel safer there, and that was helping him to cope. So each one of them benefited from that conversation, that more spiritual conversation. We have to also bear in mind that not everybody wants to feel comfortable with change, because change is difficult, change is uncomfortable sometimes, even good change. So as a spiritist, I don't rush people if they're not capable of that, because that would drive them away. But I don't feel bad about it, because I know that at some point, when it is the right time for them, they will get there. And that hope helps me to say to them, it's okay, you don't have to punish yourself even more because you're struggling. Keep going, keep believing, and you will find a way at some point. You will be able to do that. And that helps them. That in itself is very positive for them. So I think, spiritists or not, as mental health practitioners, we have a lot to learn from Spiritist teachings, because Spiritism gives us that extra, which if we just stay with the physical aspects of illness, a lot of things we can't understand and help. But if we expand our knowledge and understanding beyond the physical aspects, then there is a lot that we can do for our clients. If nothing else, at least helping them to forgive themselves, to be kind to themselves, to believe in themselves, and that goes for us as well. So thank you very much for listening, and I hope you continue to enjoy the other talks this afternoon as well. Bye.